I'm standing in front of the only supervised inhalation site that exists in the province. Yes, it's like a supervised injection site, but for inhaling opioids. And experts say we need more of them because the way Ontarians are using drugs is changing. We met with Joanne Simons, the CEO of Casey House.
And on our left is our inhalation booth.
Explain to me, what is this, first of all, before we even go in?
What you're seeing here is a switch for our fan that keeps the air recycling within the space when people are smoking. We would have the door closed, but you can see there's a window in the door so that our nursing team, our harm reduction workers, have visibility to the person who is using their substances. If the team member had to go in, they'd flip it to high. Within about less than a second, the air and any of the vapor would have left the room and the staff member can go in safely.
Yeah, and I mean, given that you guys are the only ones in the province that offer this kind of service, how would you say the demand is for this versus, the regular safe injection rooms?
So what we saw when we opened up the booth was now 80% of the people who are using our SCS are using inhalation. So there's a massive shift from injection to inhalation, and we're seeing that across the community quite broadly.
And she's right. Just look at the most recent data we got from Ontario's Coroner. It shows that in 2024, more than 2,200 people in Ontario died from opioids. 40% of them are thought to have only inhaled the drugs, up from 18% in 2018. Meanwhile, just 4% of deadly opioid overdoses are thought to have been caused by injection alone. That's down from 20% in 2018. In about half of cases, it's unclear how they took the drug.
We've seen this trend over the last 6 years of people moving towards smoking their drugs. And we've known this, and we've been reporting on this in the public health literature. We've seen this in the coroner's data. And we've been very, very slow to actually scale up programs to actually support people who are primarily now smoking their drugs.
COLA studied this in Ontario, showing opioid toxicity deaths where inhalation was the only mode of use, almost doubled between 2017 to 2021. So what's driving this?
So people not wanting to overdose, I think, was probably the most important determinant of that change.
Dr. Ahmed Bayoumi studies the intersection of public health and addiction.
Some of the risks that are associated with injection are associated with the needles themselves. So those are things like infections in the skin. Those infections can spread to heart valves. They can spread to bone. So people who smoke are certainly at much lower risk of those sorts of infections because they're not injecting. In terms of overdosing, there is some evidence that the level of drug, the rate at which the drugs accumulate in the blood is slower with smoking than it is with injecting, which allows people to control the amount of drug that they're taking in more precisely.
Even though the risk of overdose might be lower, it's still high. After all, people are still losing their lives. And that's without the other risks that come with smoking any substance.
People still need to be supervised or still benefit from being supervised in terms of their drug use.
But that's tough to do in Ontario, where the government doesn't fund supervised inhalation sites. The only reason Casey House has the booth is because of community donations. And Simon says people call and drop in from across the country to learn how they did it.
It does take some money, not a lot, less than about $50,000 to actually install this room itself. We're thinking about doing a second one because the need is so great. But it really just is the venting and the fan.
Calls for funding have floated in the air ever since Kathleen Wynne's days in office and beyond.
If the government wanted to care about the science and the data and all the residents of Ontario, then yes, I would hope that the government would expand for inhalation. But it's something we've also been demanding since 2018, since they took office.
We asked the Ontario Ministry of Health about this. They're the ones who regulate supervised consumption sites. They recently closed 9 of them and transitioned them into treatment hubs. A spokesperson said in a statement, quote, "Our government does not and will never support the use of illicit drugs in public spaces. Our focus is on connecting people struggling with addiction challenges to treatment and recovery, not giving them the tools to use toxic, illegal drugs." So while these supervised inhalation sites stay largely out of reach, experts recommend people get their drugs tested for other substances before taking them and never using alone. Naama, Weingarten, CBC News, Toronto.